That health inequities are rampant in our country. When we look at maternal mortality rates, the numbers are atrocious. Black women die at much, much higher rates in childbirth or right after childbirth than white women. Infant mortality rates, similar. When we look at the burden of type 2 diabetes, much higher rates in Black communities than white communities and other minoritized communities as well. When we talk about racialized trauma, what we're talking about is both systemic traumas, so systemic ways that the predominantly white medical system centers the needs of white patients. When we look at the vast majority of medical research, whether it's in psychiatric illness or other medical specialties, the vast majority of research participants are white people. We know that genes play a role in disease. We know that environment and culture plays a role in disease. And historically, we have not taken culture and cultural preferences and spirituality into account in modern practice of medicine. And so that is a form of racialized trauma, unequal access to care. We know, for example, that the highest increase in opioid overdose deaths are happening in Black men over the age of 60. We are beginning to, actively invest research dollars into health inequities, particularly in psychiatry. Another type of racialized trauma are overt racialized aggressions. These are anything from overt racism coming at a person of color to being, targeted by the police or stopped by the police in a predominantly white neighborhood for rolling a stop sign, where I roll a stop sign and I'm not stopped by the police, or if I am, I'm not immediately suspected of having a weapon in the car or drugs in the car. So these are some of the things that we mean when we talk about racialized trauma.